Download our app available from the App Store and Play Store. Hello, welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. The Delhi Commission for Women has issued a notice to the Delhi government seeking an order to all government hospitals with requisite facilities to provide free sex reassignment surgeries to transgender people. In July, the DCW had urged the centre and Delhi government-run hospitals to facilitate free sex reassignment surgeries for transgender people after hearing the grievances of the community. The Commission was informed by the Health Department that the facility of SRS was not available in Delhi government hospitals, said the notice issued on Tuesday. Indore-based Mahatma Gandhi Memorial Medical College has received the nod from the Medical Assessment and Rating Board of the National Medical Commission for the 100 MBBS seats that were increased at the institute, taking the total intake capacity from 150 to 250 MBBS seats. The renewal of permission from the Apex Medical Education Regulatory Body comes in respect of the third batch of MBBS students against the increased intake capacity. In a major relief to the MBBS aspirants in Maharashtra, several private unaided medical colleges in the state have decided not to increase their annual fees, and shockingly, the MBBS fees in institute like Prakash Institute of Medical Science and Research has been slashed by almost 40%. The information in this regard has been shared by the fee regulating authority of the state, which has allowed a reasonable increase of fees ranging from 50,000 to Rs 1 lakh in some institutes that demanded increase. In case of Sangli-based Prakash Institute of Medical Science and Research, the FRA slashed the fees from 8.4 lakh to Rs 4.8 lakh per annum. The fee authority took this decision on after reviewing the expenditure document submitted by Prakash College last year. Meanwhile, 6 sought-after medical colleges in the state have decided not to increase their fees. The drug major Sun Pharma has got green signal from the subject expert committee functional under the Central Drugs Standard Control Organization to manufacture and market the Progesterone sustained release tablets. This came after the firm presented their proposal along with the bioavailability study report of Progesterone sustained release tablet 400 mg before the committee. SR tablets are designed to release a drug in the body slowly over an extended period of time. It allows delivery of a specific drug at a programmed rate that leads to drug delivery for a prolonged period of time.
The enforced isolation imposed by the COVID-19 pandemic lockdowns may have impeded the social communication skills of babies born during these periods, suggests a research published online in the Archives of Disease in Childhood. Before the advent of coronavirus vaccine, mass lockdowns and mask wearing were deployed to curb the spread of COVID-19 infection, limiting babies' interactions with people outside the home and potentially restricting their access to visual and facial cues for language development. Now, to gauge the potential impact these measures might have had, the researchers assessed 10 parentally reported developmental outcomes for 309 pandemic babies at 12 months of age. The babies were part of the CORAL, or Impact of Coronavirus Pandemic on Allergic and Autoimmune Dysregulation in Infants Born During Lockdown study, and had all been born during the first 3 months of the COVID-19 pandemic in Ireland. Women with polycystic ovary syndrome or PCOS in Alabama may be more likely to have excessive hair growth and insulin resistance, whereas women with PCOS in California may be more likely to have higher testosterone levels, according to new research published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Women are diagnosed with PCOS if they have 2 of the following criteria: androgen excess, ovulatory dysfunction, and polycystic ovaries. The researchers compared data from 1,620 black and white women with PCOS in Alabama and California. They found regional differences in the way these women met criteria for the diagnosis of PCOS and in symptoms associated with PCOS, with some variations among black and white women. Predicting the rupture of aneurysm is crucial for medical prevention and treatment. In physics of fluids, researchers from the Sri Chitra Tirunal Institute for Medical Sciences and Technology, Trivandrum, and the IIT Madras developed a patient-specific mathematical model to examine what aneurysm parameters influence rupture risk prior to surgery. Aneurysms occur when the weakest point of a blood vessel thins, expands, and after a certain limit bursts. In the case of cerebral aneurysms such as internal carotid artery bifurcation aneurysm, blood leaks into the intracranial cavity. Being born below the 25th percentile for birth weight may put a child at risk for developmental difficulties, according to a new study by Abiodun Adankin of Coventry University, UK, and colleagues. Babies that are too big or too small are believed to be at risk of poor birth outcomes and problems related to childhood development. But little is known about this relationship across the entire range of birth weights for non-premature babies. To fill this gap, researchers studied the development of more than 6 lakh infants born after 37 weeks of gestation in Scotland. At around 2 or 3 years of age, the children underwent evaluation for social development and for fine motor, gross motor, and communication skills. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.